Alors bonjour et bienvenue.
So hello and welcome to this press conference together with the Premier of Quebec, François Legault, the Minister of Health and Social Services, Ms. Danielle Mécam, and the National Director of Public Health of Quebec, Dr. Horacio Arruda. Hello everyone. As I had told you, in the past few days we've done a lot more testing. So as we were expecting it, there is an increase in the number of cases. And we expect that it will be the same thing in the upcoming days. We are getting ourselves ready for every scenario. So the numbers for the last day: 181 cases of infected people, so an increase of 42. 10 people are being hospitalized, that is an increase of 9. 10 people in intensive care, so an increase of 4. Unfortunately, 4 extra deaths. So we are now at 5 deaths. So, of course, I wish to offer all my condolences and sympathies to the families and people close to those people. I would like to be specific. Out of the 5 people who died, there were 4 who lived in the same residence for elderly people. So that means that the number of places is still limited. However, it reminds us of the strength of that virus and that the situation must be taken seriously. In case there's still people who think that this is not a serious situation, we're getting evidence to the contrary. Of course, in that residence in question, where there have been 4 deaths, we've taken every single measure to try to avoid that there be no further. And it shows the importance of limiting contacts, physical contacts. Yes, right now we are saving lives. We are limiting contagion by limiting contacts. So it's still very important to keep repeating it and to keep repeating it. About the screening tests, as I was saying, we've increased the number of tests by quite a bit. So right now we have 1,500 people who are awaiting results, 9,200 who have had a negative result. Yesterday, at the end of the afternoon, we had a Council of Ministers to renew or prolong by 10 days the decree for the state of sanitary emergency. That allows, amongst other things, the health director for public health to be able to give him additional powers in order to have the orders respected. For example, when we say that we don't want there to be any more gatherings, or that we wish that people who are infected or even who have symptoms that they stay home, it's to give the power to police officers possibly to have those orders of the Director for Public Health respected. But I don't want anybody to get panicky about this. There's a few isolated cases only. The vast majority of Quebecers are respecting the guidelines. And when we look at what's going on elsewhere in the world, I am very proud of seeing how Quebecers act in solidarity with one another and respect the guidelines. I wish to come back to the displacements between regions, and I would even say just moving around, period. It is important to not move from one neighborhood to another, and one city to another, and one region to another, in order to avoid spreading possible infections. So, stay put as much as possible in the next few weeks. Today, I would like to salute a group of people that we sometimes forget, and those are the families of the people who work in the healthcare sector. The doctors, pharmacists, nurses, paramedics, all those people have families around themselves. So the spouses, children that don't see one of their parents as often, I wish to say all those families, I wish to thank you from the bottom of my heart for helping and supporting in all sorts of ways our guardian angels. That is very important. I also wish to say a word today on community organizations. As you know, we have a lot of community organizations in Quebec who render services to those amongst us who are less fortunate. And there is a situation right now, a lot of volunteers are 70 and over, so we've asked them, and they respected, they're staying at home, but that means that we have fewer volunteers to take care of those most vulnerable people. And I'll give you a few examples. Well, of course, the homeless population. We can't tell people to stay home if they don't have a residence, so somebody has to take care of them. There are also women who are victims of family violence, who for reasons of safety don't wish to be at home. So we have to have organizations that have the means to take care of the people who suffer from domestic violence. I'm also thinking of Meals on Wheels. I'm looking in my own county. Well, the Meals on Wheels, these are retired police officers who take care of that usually, and so many of them are over 70, so they're no longer there to go deliver food to those who need it. So I just want to tell community organizations, we are, together with Isabelle Charret, we are reviewing how we might increase the funding of certain organizations so that we can, perhaps in certain cases, replace volunteers by people that we could hire. We know that there are a lot of people who have lost their jobs, so we're studying and seeing how we could help them to better serve vulnerable people. I would like to end by telling you that today's a beautiful day. I feel like telling you to go read Stéphane Laporte in La Presse this morning. Anyway, I needed that. It made me feel good. As Stéphane Laporte says, the times are hard, but the spring is here. And the spring will be here. The summer is coming. To accompany people, even those who are going to walk outside alone, I insist upon that alone, take advantage of the day. Go out, have a walk alone. The spring is there. And I would like to end by repeating what I've been repeating every single day. Every gesture right now from each and every one of us is going to allow us to reduce physical contacts, therefore contagion, therefore save lives. So I once again thank all Quebecers. Thank you for your collaboration. Be careful, take care of yourselves, and together we'll get through this.
I also want to say a few words in English. As expected, we can see that the number of cases is accelerating. I'm sad also to announce that we have 4 more deaths in Quebec. It's a reminder we face a very serious situation. Therefore, I ask you to strictly apply the social distancing instruction to limit the contagion between people, neighborhoods, cities, and regions. Unless it's necessary to go out, please stay home or go for a walk, but go alone. So what we're doing now will save lives in the next coming weeks. Take care. We'll get through this together.
Nous en sommes maintenant à la période de questions. Nous allons procéder par...
We are now at the question period. Hello. First of all, I'd like to have extra information on the 4 people who have died. Are these people who were in the same residence as the first person who died earlier on this week? It's people who were, yes, grouped in a residence, and it's people who had risk factors. It's very unfortunate. We find it sad, but we knew that we were going to have deaths associated to this disease, particularly in that age group. And I want to mention that is why we took the measures that were a little bit criticized at the beginning, with the fact that we, were not allowing the elderly to have visits from their family. But it's in this context that it's important to act. And I wish to emphasize what the Premier said. It's not time to stop. On the contrary, we have cases. The virus is here in Quebec. It is not being transmitted very actively in the community, but we have to keep an eye on it. So please keep going with those measures. And the most important are the ones that we have already set up together with you. Don't forget to wash your hands. I know I'm repeating myself, but we have to repeat ourselves. Right now, we should even do it more than at the beginning, and it remains still very important. Along the same lines, you're saying that there's no active community transmission, except that one of your colleagues yesterday in Bromont said that there are already people who were affected who were circulating. Yesterday there was an intervention in Quebec of people who were moving around. We know that there are people who have tested positive who are circulating around Montreal. For you, does that represent a risk, and what can be done to limit this? Well, first, I wish to mention when we talk about active community transmission, what we're talking about here, and we have to be careful, it could start in one territory and not be elsewhere. That's the first thing. The second thing is it requires 3 generations. I don't know if you understand. So there's still stories of cases where we can investigate and in order to not get to 3. It's possible that there are 3s, but it's not yet significant in terms of quantities. As far as the people who do not respect guidelines are concerned, the orders that we have emitted, and now with the decree that took place yesterday, is giving us powers to get to the police. Our main objective is to convince, and that's what we've done in Quebec, and the response of Quebecers has been very good, and I thank you for it. Our objective is to increase that, to convince even more people who have not been convinced yet. As of now, it's clear that we're going to constrain the people who do not respect the guidelines, particularly if they have been told, if they've been contacted, and we get information that they're walking around. Those people may represent a transmission to 2, 3, 4, 5 people, so we're going to be forced to constrain those people. And we will in situations where we can document. Don't let people panic. But people have to understand, if you don't get it, and we've told you 2 or 3 times, and our public health officials, if they have information, the directors will have no problems sending officers to make sure that that person be isolated. So I don't invite people to confront police officers. It's a question of respect. The rights of an individual stop where impact to the community is high. Monsieur Legault, I would like to know your comment on the schools of perhaps going back to school in May. I'd like to understand, I know that in Great Britain there's a report that said that there are chances that the isolation measures will last until 2021. Epidemiologists who are also saying that we may have to wait for a vaccine or antivirals that are efficient before being able to go back to normal life. When you're talking about a scenario in May, what criteria are you basing yourself on? What would allow you to give you the assurance that we could open the schools? Well, what I mainly wanted to say is that we had announced on the 31st of March, and I wanted to say clear that it's unlikely that it's going to be the 31st of March. So the delay, the most optimistic delay, is the 1st of May. So we would be postponing the decision until the 1st of May. But, yes, in fact, it's possible that it's going to go longer than that. But my question had more to do with the criteria. What criteria are you basing yourself on for that decision? Well, studying the epidemiological issue here on a territory, we have 100 scenarios, right, that are possible. We're looking at all of them. The virus could disappear on its own this summer. That is the hyper-optimistic, the one that would make me super happy, and we'd all be, very happy. But it's unlikely. It could slow down and then come back. And we have to look at the dynamic. What proportion of people will have been infected? Is the virus going to continue circulating intensively if 70% of people have been infected? Now we are concentrating on lowering that curve because we don't want to overwhelm our health system. We don't want to have to choose between one person or another. But people are going to talk very often of hypotheses, of possibilities. We are looking at all of them. But the decision is taken looking at what is happening from one day to the next. And what I'm telling you today, I'm telling you with the data that we had up until midnight yesterday. And we're going to keep looking at the situation, what's going on in the Estrie region, what is going on in Granby, what's going on in Montreal. And with that information, we apply our different principles. And what I want to tell you is that even if it accelerates in an important way, what we've already set up is already, I would tell you, a great impacts most people. So we have to balance, because society has to work. I don't know if you understand. So we're not taking any chances, but we have to balance things out. But I'm not going to talk to you about the 14 scenarios we might have. We might have 14. You're going to hear all sorts of things in the media, and that's fine. That's part of freedom of expression. But be assured that in Quebec, in relation to other provinces, we are relatively, and when I say that, I'm talking about the situation today. I don't want things to deteriorate, but there will be cases. It's serious. But if you do, as we say, I would tell you that we are in a better position to be able to lower that curve, and we'll reevaluate. The more we reduce the curve, fewer people are ill. The fewer people who are ill, people there are fewer people protected, then it could come back, but it depends on how the virus behaves. What effect do these confinement measures, what effect have they had on the projections that were made on Monday? In other words, Dr. Arruda, are we just displacement the curve, or are you confirming that our measures are showing that we are flattening it? We've applied the measures using experiences. And I would say that it's a little bit too early because I told you that it takes 10 to 12 days after the measures to be able to see the impacts. And at the same time, we are increasing the number of screening tests. So do you get it? There are some factors that make the reality increase and others decrease, because the reality is that there's no country that has really had it, because all sorts of people had the disease who were not tested, right? This denominator. But what I'm telling you is that what we've done is based on what others have done. We didn't contain a province. We haven't yet, because we're not in the same situation. But what worked the best is social distancing, as well as stopping. And I'll give you an example. If we don't just do social distancing, but people get together, they have parties together, somebody who's infected is going to infect 8 people, and it's going to get even more complicated. So everything that we're doing right now is what works the best. I've been asked questions, stores. It's not so much when you go quickly out, when you're in little contact with people, that people get infected. There are, but it's very low compared to the investigation that we make around cases and a contact. The residents, we make sure that it doesn't become something that goes out into the community. That is more important than closing down stores completely, for example. But if we have to get to that because there's too much circulation as such, we'll do it. But it really is gatherings of people together, closer, in families. Those people are at risk. When people start moving around a lot, your neighbor perhaps won't know but might be infected. So it's a lot more. When you are together for a long time in a smaller room, that puts you at higher risk than going to a store while being careful about social distancing. And if it changes, we'll tell you, and that's what's important. Yeah, this is what gives us more time for the network to get ourselves ready. And we are continuing to prepare the network. We're at 4,600 beds that have been freed up. So we are continuing as well to free up beds for intensive care. And I want to take this opportunity to thank people. And I think that this has to be done every single day, as the Premier has said. I would also like to add pharmacists, therapists, the Premier said, paramedics. We can't forget the administrative staff, the people who work at the ministry, the people who work in different labs. All the support of the network, but in the community as well, the police officers, the firefighters, the municipalities, and the families of all those people, as Monsieur Legault was saying. So I want to tell you today that the network is preparing itself for the response to the need of citizens, and that is evolving very well because our citizens are following us and are taking those measures. The more time you give us, and we're talking about many days, the better we'll be able to prepare ourselves and prepare the network to help those people out who will need care.
Madame, Messieurs, bonjour. I
have a question on the projections, the curve that you're talking about, because yesterday there was reason to believe that there was something positive that was happening. We were thinking that perhaps there were going to be an inflection of the curve. What does that mean, the results that we have today? We're talking about a total of 5 deaths and a significant increase in the number of cases that have been reported. But the 12 days that you're talking about is happening on Monday, if you're looking at the first measure. So what are you looking for on the curve? I know that we don't want to let down our guards, but there's a fine line between unfounded hope and the guard that we want to maintaining that guard up. Yes, I would like to replace the perspective of the population about the curve, Canada versus Quebec versus China versus etc. The curve in Quebec and the curve in Canada is the sum of the curves that are taking place all over the place. In cities, we can see a curve that does this, but we're not in the same perspective as China because, when we add the curve of Quebec, of Montreal, of Laval, the curve is going to have another trend. We started having a certain inflection, but we knew that we weren't testing enough people, etc. My epidemiologists have told me, and we're going to have the data, because we also have to know that right now we have recovered a certain, caught up on a certain backlog of cases, and we've centralized a lot of tests because it was important. For us, statistics are super important. The main priority is to treat people, and second, to take care of patients and having a good idea of what's going on. We might have decided to wait another week to decentralize everything, to have tests and tests, to have a perfect technique in exchange of information. But what we wanted to do was act. So, to a certain level, I would tell you that we have, perhaps we've had to catch up, but we didn't want to stop the test. And honestly, I can tell you that it's possible that we see that inflection, and now these are hypotheses, right, might re-increase a little to then go back down a little depending on that event. But we are not, my epidemiologists are saying that even though we had a lot of cases, and we're probably going to have some that were made in certain days that were announced, and we're not in a situation where the scenario is being taken into account, but we are monitoring it. It's normal that at the beginning we'll have more serious cases because those are the ones that are being measured, because we haven't yet broadened all testing populations. But, and we'll tell you as things change. If we have to do anything differently, we'll tell you. But right now, already, if you'll allow me, what we have been doing, it's we were in acceleration already. We put it ahead of time, with convincing people. And now, if we have to constrain, we'll constrain, and we have to take other measures that are important. I'll give you an example, If we get to that process, we'll do it. We don't want to take any chances, but we want to increase our capacity, and we evaluate things on a daily basis. I will ask a question myself. Terre-Neuve or Newfoundland also wants that people who come from other provinces not be allowed in. Mr. Ruda also talked about the possibility about a possible control between Quebec and Ontario. Is this things that are these things being studied to tighten the control of Canadians come from other provinces in Quebec? Well, listen, I said this as being a possibility amongst others, but you have to understand that the Ottawa and Ottawa is like the same region in terms of exchanges of services, etc. People work on one side, etc. So we could have an approach of closing the border, but it's just a political administrative border. The population itself is the same. I don't know if you understand. The Ottawa and Outaouais region, I mean, if we had to do anything like that, we'd have to discuss with Ontario, but then we'd have to, talk about that area and other areas in Quebec. But myself, of course, I'm not excluding anything, because I don't want to exclude anything. It's possible technically, but as I was telling you, it's as if I were to tell you there are cities that are easy to separate, but the city of Gatineau with the city of Ottawa, apart from, it's two differences, but it's the same region in terms of social life. And that's just one example, even for the care, So if you don't have enough care in Gatineau, you can count on Ottawa, and in Ottawa it's the opposite as well. So. Have you been talking about the Sûreté du Québec and the different police forces to eventually tighten the constraints to citizens through fines, for example? Is it possible to emit fines? And there's also people in the Charlevoix region. We've heard that there are tourists that have been moving around there, that are walking around through the population, and that are just simply there. Could there be more serious constraints, things imposed by police officers with fines? Are you talking with the Sûreté du Québec? There is nothing planned for in the short term. There are isolated cases. Geneviève Guilbeault, the Minister for Public Safety, is speaking with the different police forces to be ready if ever it is necessary, but we're not there yet. And we don't wish to get there either. I think that what we wish is we don't want to create chaos. We want Quebecers to do it in good faith. And when I look at what is going on elsewhere, we're pretty good. Mr. Premier, the Canadian government has announced the repatriation of Canadians today. There's a lot of Quebecers who are stuck in foreign lands, in certain places where airports have been closed down. Are you in discussion, and do you have good hopes that we can bring all Quebecers home? First of all, there's a situation where we have to be very careful. If some of those people have been tested and tested positive, we don't want to bring them back right away. There might be a delay of up to 14 days until the symptoms are no longer there. But in fact, airlines are collaborating to do it at reasonable tariffs for those people, but it's not simple because in a lot of countries, and it's small amounts, but I think that the federal government is doing good work and we are coordinated in that work. I was wondering, for those people who are in intensive care, are you going to start telling the age groups of the people who are in intensive care? Is that data that would be useful to make public? Well, we still have very small numbers, but the information that I have is that these are all people who are older. To have a categorization, first of all, we have to be careful with the questions of confidentiality. But when we have sufficient cases, we'll be able to give you age groups, between this and that age and that age. Right now, from what I understand, these are people who are part of the group of people that we said that had risk factors. And it can be, it's dynamic. They can go from critical care to regular care. So when we get more cases, we'll see how we present things. But right now, I do not have, people are ill if they're in intensive care, but these are people who had risk factors and have a certain age. It's different from a profile, for example, who had young people who had other kinds of symptoms. We would adjust our messages to the population as well. I also want to say, so that people understand, there are 19 people who are being hospitalized, 10 of them in intensive care, and Danielle was saying that there are 4,600 beds, 4,600 beds that are available to be able to welcome more people who may need to be hospitalized. So there's a whole leeway. But I'd like to come back to the question of the evolution. It's important that we look at the number of cases per 100,000 capita and the number of tests as well, that we compare ourselves with elsewhere, and that it's going better. Things are going better here than the average. Of course, if elsewhere there's a very accelerating curve and we have one that is accelerated but not to that extent, that's a good sign. It doesn't mean that we can't expect for there to be an acceleration. It will continue, particularly taking into account that we are screening more. So by screening more, automatically, if we keep the same ratio that we had in the last few days, we'll see more people who will officially be infected. So that is why we are following. Every day, it's not always simple to have everybody's data in every country, but we are trying to do so and keep an eye on it. It's not a very precise method, but I can tell you that I have a very close look at them. And it's a huge operation, and everything that has to do with screening, 811, everything has increased and improved. The labs can answer. And what I wish to say as well is that the network, I've said it, but I want to say it again, it's also putting itself in social distancing mode, but from a constructive point of view. Right now, any interventions are going to be done a lot more over the phone as far as medical clinics are concerned and psychosocial services. Teleconsultation is something that is going to take place everywhere, in hospital centers as well as in medical clinics. There's also going to be some in CHSLDs. We are placing all of that and setting it up. So as much as possible, we are going to be doing any intervention at a distance to protect everybody. But even at the psychosocial, we invite all the people who work there to call the people with whom they normally work. If they don't have any social workers, they can call the clinic, the CLSC. There's more, anxiety right now. We want to be able to respond to that, and we want to have a more targeted plan for the psychosocial aspect in Quebec. And within 2 days, we'll be announcing that to you. And we are taking care of our people. And I can tell you that the emergency wards right now, we've never seen that before. The average of the occupation rate, you're familiar with that, we're at 66%. I haven't looked in the past hour. It's probably even lower in Quebec. So everybody is below 100%. That is really freeing things up. And now there are people, of course, who are going to be reaffected or reassigned. So we'll ask them to go to other services to be able to help out. But there's, breathing room now with 4,600 beds. So we are taking care of the people who work in the healthcare sector as well. And I have something to tell you that is very important. We evaluate every single scenario. We're not sitting back and not doing anything and thinking, oh, it's going so well, and then tomorrow pay the price. But we have been very proactive, freeing things up. We started doing that even before we needed it, because we know that when we are reactive, that means that you're already a little bit late and it's more difficult to implement. But when you implement things, there are adjustments, the 811 line, the 1-800-77 number. It didn't work perfectly at the beginning, but we adjusted ourselves. We wanted to have that leeway. We thought, let's start right away, even if we didn't need it. We had that opportunity and that luck, actually, to see what happened elsewhere. And we were lucky to be able to see what happened elsewhere. It allowed us to be as proactive as possible and not reactive. That gives us leeway, and that gives us, that when we bring something up, we have the time to tweak it and improve it. That is what Quebec has done. Proactivity, freeing up for the healthcare system, and setting up of measures with responses. So we didn't get, here from one day to the next, okay, everybody stay at home, we're not going to talk to you anymore. People would not have reacted well to that. Quebecers are following, they are there for us, and those who haven't understood yet will make it so that they do. And with that, I would love to already be at the beginning of May to be able to tell you the result, but we have to go from one day to the next, but not you or us. We can't stop. Should we understand that 4 of the 5 deaths took place in people who lived in the residence in La Naudière? How many are waiting for a test? And you were talking about the beginning of May, Dr. Ruba, but the peak of the 5th of April, is that what is being thought of? Are you talking about the number of people in that residence? You have to understand one thing. Myself, I don't have all the very specific data for reasons of confidentiality. And I want to make sure that I've understood your first question correctly. Are you talking about this residence? Sorry. Well, the Premier said that, the 5 deaths happened in the same residence. I think that's what I heard. And the answer that you gave, Dr. Aruda, was that I interpreted it in that way. Yes, he's right. 4 in the residence and 1 community as such. The Premier is right. Okay, in the community? Well, it's a person, that is to say, who was not in that residence, but who died. It's somebody who wasn't necessarily in that residence, but who was at home. And for the 5th of April? Right now, we are screening people who have traveled and who have symptoms, okay? We have greater capacity than the demand right now. The demand, let's say that is 3,000-4,000 per day, and we have a capacity of at least 6,000 that we can test. Eventually, and we're preparing ourselves to that, we could start testing people who have not traveled, but who have symptoms. So that is something that we'll have to have even more screening tests. So we're getting ourselves ready. But for the time being, the demand is inferior by quite a bit to the capacity for the people that we want to test. That is to say, the people who have symptoms and who have traveled or who have met up with people who have traveled. And all the network, or all the people who work in the health network who have symptoms. Those are the people that we're testing right now. So right now we have more capacity than the daily demand. And are there people who are on waiting lists for those tests? I mean, people who are waiting to receive the test? How many people are waiting to be able to test it? The people who are waiting for results is 1,600, but there's nobody waiting, or 1,500, I'm sorry, but there's nobody in the category. We can do more each day than what the people who are asking. Where there's a waiting, it's to get the test result. And as you can see here, it's been lowered by a lot. There's only 1,500 left, who are probably going to get their answer tomorrow or the day after.
Alex Boissonneau, Radio-Canada.
J'aimerais juste savoir comment ça se passe.
I would just like to know how things are happening in hospitals, in the health system. We hear that there would be a lot of managers in the network, in the national capital, amongst others, who don't necessarily respect the guidelines that you've sent, whether it be for working from home of certain employees, whether it be for employees who are 70 years and over who work in the network. Are things going well in your relationship with the union? How are things happening? Well, in the establishments, but I'm aware of the situation in the national capital, and we've had contacts. The Deputy Minister had contacts with the establishment. Our orientations are clear. It is working from home in every possibility. Of course, there are moments when it's not possible. There are places where it's not possible. So we have to take protective measures, the ones that we've been talking about. And also, workers 70 years and over, well, of course, they in health, we need them. We have a lot of doctors, for example, who are 70 and over. But that is where we have to evaluate case by case, and we have to put them in a situation where they have protective measures. So these are our guidelines for employees in the network. And I want to repeat also what Daniel just said. Since the very beginning, we've been saying, for example, the doctors who are 70 and over, we evaluated case by case. I've seen in certain places that there's a difference. We don't follow the guidelines. No. Our guidelines have always been, since the beginning, for doctors 70 and over, it is case by case. Does it depend? Do we have any other doctors available in that place or not? So, we are balancing inconveniences. And we've always said since the beginning that it is possible that there are doctors 70 years and over who will be working in the network because we need them and that we believe that it's important that they be there, and of course, that we have their agreement. 70 and over, however, for the rest of the staff, is that case per case as well? Is it the same thing for the rest of the staff, for, nurses? It's case per case.
First question to CBC, Josh Grant, please.
Bonjour tout le monde. Thank you for being here today. For Mr. Legault, you explained in French. I just want to get an explanation in English, if you don't mind. What are you doing to reinforce the measures that have been put in place? We saw a woman in Quebec City who was arrested yesterday. You're saying it is isolated cases. You also mentioned that Minister Guilbeault is already sort of in planning and talks with the SQ, the Sûreté du Québec. What are the options to sort of step up if you need to enforce the measures that are in place?
Okay, to enforce the measures, we have to understand that we have the power to do so. So right now, we've decided not to use this power, not to ask police people to make sure that there's no people together, that there are people that have to be home or home, except for very, very few exceptions. We decided that the goodwill is the best approach. And so far, we'll continue to ask for the collaboration of all Quebecers.
And we understand that the SQ is going to be involved in helping explain and inform the public. They announced that today. Are you coordinating with them on that as well?
Yes, absolutely. So Geneviève Guilbeault asked them to inform the population. So it's really a campaign of information like we're trying to do in many other ways. By the way, there will be some phone calls for all people at 70 years old and more in English. So we're working with few people that are known to do that. So we'll probably announce that tomorrow.
Questions from Global, Raquel Fletcher. Last night at Hotel Dieu, testing center in Montreal, dozens of people awaiting testing were lined up in the hallways for hours, much too close together. Why and how did this happen?
Well, we'll look into that because we should really apply what we are asking, that there would be a certain distance, 1 meter or 2 meters between every person. So we'll look into that for sure. But what I want to tell you is that we're going to increase the capacity in Montreal by a lot, probably 2,000, at the beginning of the week. So we will announce that very quickly.
Questions now from Phil Authier, the Gazette. Police yesterday arrested a woman in Quebec City who would not respect self-isolation. The mayor of Côte-Saint-Luc is asking for quarantine because people are still going out. Are stricter measures coming to try and prevent these things? If not, what is the next step?
Okay. I think it's two different cases. In Quebec City, there was somebody infected that didn't want to be at home, so we have to enforce. In Côte-Saint-Luc, it's not the same situation. Of course, we have few people that are infected. Some are scared, but there's no reason. We've looked at that. There's no reason for forcing anybody in Côte-Saint-Luc to be at home.
And the last question from Raquel Fletcher, Global. Parents still taking their kids in playground or soccer field, should these be closed?
It's a question of judgment. Of course, children have to stay from 1 to 2 meters from other children. It's not bad that we have children in some parks, but it's a question of judgment.
Exactly. You know, for families who are going to be inside for a long time, kids must go elsewhere. So where are they going to go? I think that it is don't have crowds in playgrounds. Please try to stay there and perhaps go somewhere else to help somebody else coming, you know. It's very difficult for me to tell it, but it's the same principles. Don't let your kids be with them. They are with you. Play with them. Don't send them to play with the other family because we don't know if they travel or not. It's clear that normally we let people get together, but now we need places to go. And in concentrated cities, that's sometimes where the park is the place where we are used to go. And we need to get out to take some fresh air. But just try to keep in different families distancing from each other in the park. So it's a kind of judgment. And if you're afraid, if you have a kid which have an immunocompromised situation, he is treated for cancer, don't go there because there is a risk. But just be like this and check others if they are using etiquette respiratoire. So I think it's a question of judgment because if people are going to stay in their apartments and don't go outside, they can get crazy.
Madame, Messieurs, merci beaucoup.
Merci.
Thank you very much. We talked a lot about confinement and fearing and not letting our guard down. The peak, to just explain to people, when are you expecting it? We're now Saturday night. You did a call out to young people. They've been stuck at home for a week. What are you saying? What we're saying is we can't stop with the measures. We have to remain prudent. And we do not know when we're going to get to the peak. Is it going to be in a month, in 2 months, in 6 months? There are many scenarios that are being studied. It is important. Mr. Arruda said so continuously. Young people, it's Saturday. I know that it's boring, but you can't be in groups tonight, including in anyone's home. And I said, when we see the effect 10 or 12 days later, when we start seeing the effect, the worst that we could do is to let down our guard. Thank you, everyone.
Were those transmitted within the home? You said one person was at home?
They were transmitted in the same place for elderly persons.
Thank you.